Chantel.
Hi.
So we got your lab results back, and it turns out that you're positive for systemic lupus erythematosus, which I'm sure you understand is an autoimmune disease.
Yeah, I do. I'm a nursing student.
So I brought in Emma with us today.
Hi.
Hi.
She is part of the Lupus Canada Association, and she has lupus herself, so she's very knowledgeable.
Okay.
Okay, if you don't mind her saying.
Yeah, no.
So just to start this off, I'd like for you to explain to us some of your symptoms that you've been experiencing.
Okay. When I'm in the sun for too long, I usually get a butterfly rash on my face.
Probably a result of photosensitivity.
Okay. Also, when I exercise, I usually get achy joints and have difficulty breathing. Another symptom I get is hives, but it lasts a lot longer than normal hives.
Okay, so your achy joints, your breathing problems, and your hives are all the result of inflammation. So the achy joints is a result of the inflammation in the joints, which is usually known as arthritis. Your breathing problems are a result of inflammation in the pleuris membrane. The pleuris membrane allows your lungs to expand and contract smoothly.
Okay.
And what you think is hives is actually vasculitis, which again is inflammation, but in the blood vessels.
Okay. Where does this chronic inflammation come from?
So in your lab result, it shows that you had a lot of ANA in your system, which is common. Well over 95% of lupus patients actually has this. ANA stands for anti-nuclear antibodies. So basically what this does is it attacks the nucleus of your own cells, and then this is what causes the chronic inflammation. The thing is that it doesn't usually localize in one spot. It's systemic. So systemic means that it attacks multiple systems all over your body.
Okay.
Yeah, and to go on to add to that, what likely causes lupus is a mutation on the 6th chromosome. The 6th chromosome is responsible for the human leukocyte antigen.
Okay.
Now, this antigen codes for the MHC proteins. These proteins act as the cell's identification card, so it displays whether it's foreign or part of the body. So because of the mutation on the 6th chromosome, which affects the human leukocyte antigen, these MHC proteins display as foreign rather than part of the body, and so those anti-nuclear antibodies that she discussed come in and attack those supposedly foreign cells.
Okay. Since it relates to chromosomes, is it possible that it's a genetic risk factor?
Genetics do play a role. If somebody in your family has an autoimmune disease, you're more likely to have an autoimmune disease yourself. It's actually more common than MS. There's other things that actually contribute to it that makes it a bit of a risk factor. Being out in the sun, estrogen, like those that you see in birth control pills, and especially with you being of childbearing age, your estrogen levels would be a little bit higher. Being African Canadian, medication, and certain drugs, such as those that you see in tuberculosis.
Okay.
Yeah. One of the things that you didn't mention, but you should watch out for, is complications with your kidneys. The kidneys are a common site for inflammation.
Oh, okay. Glomerulonephritis?
Yeah, glomerulonephritis.
Okay.
So because of the inflammation in the glomerules, the kidney is unable to fully process your blood, which can result in excess fluid and waste being withheld, usually causing weight gain in the lower portion of the body.
Okay. So, in summary, lupus is chronic inflammation of the parts in the body, such as your joints, blood vessels, your kidneys, and membranes. This can prevent your organs from carrying out their regular functions and maintaining homeostasis. Lupus is caused by the alteration of MHC protein in the cell membrane. This is what helps display the body cells as foreign or not foreign. But in lupus patients, it is displayed as foreign, and that's why they're attacked. The DNA is usually targeted when being attacked. Some risk factors are genetics, being female of childbearing age, sunlight, stress, and medications.
Yeah. One thing just to add about the homeostasis and organs, something that can be used to maintain homeostasis for the kidneys is dialysis.
Okay.
Yeah.
All
I
right.
think that sums it up.
Yeah, I'm very impressed by how quick you learned about lupus. And I'm looking forward to future appointments with you.
Okay.
All right, farewell.